Thank you very much.
Yes, and the webcast has started.
Well, welcome everybody to the Hampshire Local Outbreak Engagement Board. This meeting is being held remotely and members are in attendance via video conferencing. The meeting is being live streamed and will also be available for repeated viewing. And I think probably I can accept the names of the people that are here already without reading them all out, if you're happy with that. I also welcome Councillor Jackie Porter to the meeting, who wants to make a short statement at the beginning of our proceedings, and I will get her to do that very shortly. I'd also like to remind members of the standing orders continue to apply, and as I've said already, please keep your microphone muted unless you want to speak. Moving on, and just to confirm, we have myself, Councillor Manns, Councillor Liz Fairhurst, Councillor Judith Greivsky, and Councillor Patricia Stallard as members of this committee, and in attendance, Councillor Keith House, Councillor Ken Rattigan. We've got Keith with us, have we?
We do.
Yes, thank you. And Judy Gillow and Laura Taylor. Just to check whether we've got any apologies for absences, Samira?
No, none were received, Councillor Manns. And
can you just confirm that we have no declarations of interest if anyone has anything to declare? Right, moving on, the minutes of the last meeting held some time ago now. I've got September down, is that right?
2nd of November.
Yes, that's right. If we could check those minutes, are you all happy with them? If you're not, put your hand up. Otherwise, I will take your agreement as being accepted. Anyone got any comments at all? Right, moving on to item 4 now. I haven't got any specific announcements. Obviously, you will know that we're in tier 2 and that particular tier will be reviewed for the 16th of December in just over 2.5 weeks' time. Next, we don't have any deputations as such, but I would like at this point to ask Councillor Porter to make any statements she has on the contents of this meeting.
Thank you. And it's obviously not easy to see exactly what's going to be talked about at the meeting, but I just wanted to raise something. Well, first of all, I wanted to thank the Education Department for their work, and Education Advisory Panel yesterday, we heard the full range of what that means, and as a school governor I know what that means as well, so really appreciate it. And I understand that since I booked to come to this meeting on Monday, there is now a special decision day, which I think will address many of the points that I was going to raise anyway, so I won't go into those until we've had the decision day on Monday. Okay. But I just remain concerned that Perrin School are returning on the 2nd of December, and parents are still concerned, and so is the community. And I've spoken to Brian Pope in detail, and I know that Darren Carmichael is working with the school and also the comms department, but it actually is getting to the point where we think it's affecting the well-being of the town as well as the parents and the children and the economic well-being. And I wondered, in cases like this, what role the county council has in working with particularly non-maintained schools to make sure that the community communications are as good as they would be in a maintained setting, and how we can reassure a community that actually all the right pathways are being followed?
Thank you, Councillor Porter. We'll certainly take that point on board. Simon may be able to mention something about that, Simon Bryant, when he speaks shortly. But in addition, I will certainly ensure that the Education Department, Children's Services, understand the point you're making about there is a fairly sophisticated chart they use for the advice they give schools, dependent upon the type of outbreak. But I take on board your point about ensuring that the community around the school understand the issue as well.
Thank you.
Thank you very much for your contribution. Moving straight on to item 6, Outbreak Control Position Report. Could I ask Simon Bryant, the Director of Public Health, to introduce this report?
Good afternoon, Councillor Mann, and good afternoon, Board. Would you be happy if I shared a presentation with the Board of the latest update petition? Apologies, it's just warming up there. There we go. Is that being seen by the Board?
Yes.
Great. Thank you very much. And I know we've had many informal briefings. This is really an update on the situation and an update on the tiering situation and the rationale that we've been given around Hampshire and pick up some of those cases, these issues raised. So with regards to the 7-day rates, you can see there across England, the rate is 209.1, and Hampshire, the rate is 113.8. The numbers in brackets to the right are the figures earlier in the week, and we can see that the Hampshire figure for 7 days is 1,574. So what we've seen over the last few days is those figures coming down, which is really, really encouraging and positive. I think I'm beginning to have more confidence in the trend than I did have earlier in the week, and the lockdown has had that impact of bringing those down. And you can see that across Hampshire, Isle of Wight, Southampton and Portsmouth, and indeed the rest of the country. I put the northeast up there because that had one of the highest rates, and that is coming down. And you can see the text on the right hand side gives some of that information around the positivity rates for different parts of the country and different age groups. We're beginning to see that positivity rate, particularly in older people, the pillar 1. So people are being admitted to hospitals, older people are being admitted and they're being tested positive, whereas the younger people are being tested through the community, which is what you'd expect. The tiers, so this is the information that was published on the government website. So the rationale, which I agree with in terms of tier 2, there's a mixed picture across our whole area. Overall case rate is now falling in most areas, 152 per 100,000, and across all our districts we're now seeing that. That wasn't the case earlier on, but we're now seeing that falling in all areas, which is really, really positive and very encouraging. And NHS admissions were increasingly rapidly going up until mid-November and now stabilising. So we've seen a number of admissions, but that is stabilising as well. This map really helps us understand the spread of infection throughout the country, and probably having seen the tiers and where they are in the different parts of the country, you can see the rationale for that based on this map. You can see the northeast, northwest and Yorkshire and Humber being those dark reds, and then also Kent here, which we've heard a lot about on the news, that's gone into tier 3, and then areas such as Slough and London, and also our colleagues on the Isle of Wight and in Cornwall being in that lower tier. But compared to week 45, you've seen that go up, so we need to keep an eye on that on a week by week basis. So it's really useful just to give our kind of neighbours that we don't often see at this board, and we can see that there's different rates in different countries. Wiltshire and Swindon, Wiltshire and Swindon, Dorset, and then Bournemouth, Poole and Christchurch. So again, just seeing there's different rates across different parts of the country. With regards to the pandemic spreading across Hampshire, we can see again on this right-hand side of the graph, those cases beginning to come down, with the figures in grey that are not yet validated due to the data, but we can see that those figures are beginning to come down in a really positive way, but very cautious about that, bearing in mind we have now started to see the impact of lockdown, which ends next week. And our 7-day rate, again, this kind of gives it a little more clearly. You can see the figures coming down there. And then our case rate for 60 plus, just for a reminder to the board, we're always concerned about that because we know those people of that age are more likely to be hospitalised and have serious impacts of COVID. So we want to keep an eye on that, and it's really positive that's beginning to come down as well. And then when we look by district, you can see those rates. Bear in mind, this is the cumulative rate from the beginning of the pandemic, so we can see which districts have had more cases than others. And again, you can see that England's right at the top and Isle of Wight at the bottom. And then this map helpfully shows the rates by district. You can see that we've got Havant here being one of the highest areas alongside Portsmouth, and we're looking at that with a case rate of 206 per 100,000, and then Hart at the bottom of that list with 76. And always worth saying that those rates vary, kind of over time, so we keep an eye on that, and different districts will have different rates due to the smaller populations that cover a district area. And that's our rate in a kind of graphical form. Just moving through very quickly is the hospitalizations. As you can see across the country, the southeast here has a rate on the right hand side that going up lower than some parts of the country, but higher than perhaps the East Midlands and southwest of England. And then when you're moving on to ventilator beds, you can see again that the rate there. And here you can see the number of hospital admissions. Worth just pointing out, about 40 people admitted to hospital per are in hospital currently. And then the death rate, sadly, we are seeing increase in deaths. So the latest figure is 14 per 100,000. 14 in the last week from COVID, and still below the 5-year weekly average. Councillor Manns, I'll stop sharing that presentation and happy to take questions as helpful.
Thank you very much, Simon. Can I take questions now from anyone who's got any questions on those figures? Councillor Fairhurst, Liz.
Thank you, Councillor Manns. Simon, I know there's a set of 5 measurements that decide which tier we're going into, but given that our rate is coming down, hospital admissions are coming down, what do you think our chances are of coming out of tier 2 on the 16th of December?
Councillor Fairhurst, I guess that's the question we're all asking ourselves. How do we move forward? So I think we are looking at, as you say, there's a number of indicators, including the 7-day rate, the rate in 60 pluses, and our hospital catchment. And it's a science and an art together. I think we need to see some sustained drop in those figures for a significant number of time, because what we're worried about is if we come out of these restrictions too early, those cases will just go back up. Particularly bearing in mind we've got a loosening of restrictions around the Christmas period. We want to be really mindful of that, and I think what we might find that is happening, that we stay in this tier for longer to make sure we can manage Christmas and then come out sometime in the year. But I don't know, but I think we need to maintain our strong position and the good work that's going on.
Thank you.
John.
Thank you, Chairman. It's just a point rather than a question to build upon Simon's comment then, and also to build upon Councillor Fairhurst's question. Councillor Fairhurst asked the question very carefully, and her language is absolutely on point. But some of the material I've seen in the last couple of days about the rate of increase has been confusing in its presentation, and I just think it's an important point to make here. The rate of increase is dropping, which is great news, but it's a very recent start to it dropping. But it's still an increase. I hear people talking about the increase has dropped, but it's the rate of increase that's dropped, and I think we've got to be very, very mindful of that. I have to say, digesting the news over the last couple of days and looking at the material that went into it and looking at our position, it does feel to me like the current tier is an appropriate one, relatively speaking, for where the rest of the country is at. And it is this issue about the rate dropping, which we've got to be very, very mindful of. The virus is still alive and kicking in the county, I'm afraid.
Thank you, John. Yes, very good point. Ken Rattigan.
Thank you, Simon. The death rate across the country is still too high. I would like to know some thoughts on the interaction between the COVID infection and how it will play out with other illnesses and diseases, and will it cause them to be worse? Has any clinical work been done on what additional effects having the COVID virus will have on other outcomes and other illnesses, either respiratory or otherwise, so as we can pull this death rate down?
So you're right, Councillor Rattigan. So one thing to say is we know that the death rates are a lag on both infections and hospital admissions. So we'll see those carry on going up for the next few weeks, whilst we're seeing, as the Chief Executive said, the rates in infections coming down. So yes, we are concerned about that. And also we're beginning to see, as you're highlighting, those winter illnesses that may cause, and we're used to seeing in our hospitals in the winter, such as flu. So if there was a combination of flu and COVID, there would be a much worse outcome. And we see that with other long-term conditions. So we've seen that with people who've got certain weight issues. We've seen the outcomes worse. So we know that COVID combined with other things will cause worse outcomes, and that's why we're really concerned. And we have seen a really good push on the flu vaccination program this year and a really good uptake. And I really want to encourage everyone to have a flu jab if they're eligible. We've now brought that down to age 50 plus because we know that the outcomes could be worse. Equally, if we've got people going to hospital with flu, but some people have serious complications from that alone, so we'll know that our health system will fill up quicker with a number of illnesses circulating.
Thanks for that, Ken. Keith House, Councillor Keith House.
Yes, thanks, Keith. It's a comment really as much as anything else, and following on from John's point, which is that it relates to messaging really, but it fits here in discussion. I'm very keen that we don't raise expectations about reducing the tier. I know there's all sorts of pressures from the hospitality sector, from some of the MPs as well, to reduce the tier categorisation. But my concern is that we move out too early. We have totally uncharted waters coming at us at the end of the month. We have no real idea what the effect of Christmas and the New Year will be. We can hazard a guess there are some positives there, in the sense that there's 2 and a bit weeks without schools, so there's less contact activity there, and there will be some more people not at work. But in the other direction, of course, we've got probably the biggest set of intergenerational contact since pre-lockdown happening with the loosening of restrictions. We'll also have an absolute bonanza of retail over the course of the next few weeks, and I think social distancing is going to could be a real issue in some of these areas. And then we've got New Year, and whether it's possible to maintain common sense over New Year with mainly, but not exclusively, the younger elements. So I'm really worried and concerned about the consequences of all those things that are verging into unknown unknowns, or at least known unknowns, and what the consequences are, and therefore sticking where we are in tier 2 and keeping the expectations of being in tier 2 feels to me to be the line that we want to be talking through and just being confident about.
Yeah, Keith, you make a good point. I think probably I'd add to it, though, that the future decision as to which tier we're in the middle of next month also allows us to encourage people to stick to the rules as closely as possible. In other words, you're right, we may not come out of it, but I think if we get the message over to people that now's the time to really stick to the rules, particularly with your comment about retailing, I entirely agree. I think it's not a good idea to visit some of the shops next week because they're going to be really very full if one can avoid it. So that's I think the other point I make, which is really related to it, is, and this also relates to the vaccinations that we'll probably come on to in a minute, is we need to under-promise and over-deliver rather than the other way round. There's nothing worse than building up people's expectations too much and then not being able to fulfill them. I see Judith's hand is up.
Yes, thank you, Keith. I just wanted to agree with what Councillor House has just said, and also what you said about under-promising and over-delivering. Whether or not we come out of this tier is really in the hands of all of our residents. This morning, somebody sent me a photograph of a shopping aisle in our supermarket in Chandersford, and I'm just glad that I wasn't there. I mean, absolutely horrendous. There is a real pressure there, I think. Managing people's expectations, yes, that's very important. I'll be saying a bit more about that at my agenda item. And the thing about the rules is, just because you can doesn't mean you must. And I think that is the message that we've just got to get through to people. I'll leave it at that for now. Thank you, Keith.
Thank you, Judith. But Simon, sorry, I should have asked you to come back before now. Apologies.
Not at all. I think what we're all highlighting is actually we need to really continue to promote the good messages of good hand hygiene and social distancing. It's going to be really key in these next 2 weeks. And yes, we're in a different, we're not in a national lockdown, but those messages haven't changed. And I think our good communications team at Hampshire County Council and in the districts, we're pushing those messages out really hard. We need to continue to maintain that. So, as we've all said, that we can move forward and move safely through to tier 2, and then hopefully without too much time, tier 1 when appropriate.
Thanks, Simon. Ken.
Thank you for the opportunity again. Simon, you earlier raised the issue of obesity, and I hate to bang on about this, but it is, while the public are taking public health messages much more serious than they've done in the past, is there something more that you, as the Director of Public Health for Hampshire, or your clinical colleagues in GP services can get out additional messages that people will take on board about healthy lifestyles are important? And we all know that we all eat and drink too much over Christmas and New Year, and that's adding to an already existing problem and may cause people to fall into the healthcare system much quicker than they would, whether it's COVID related or those other issues that will mean that they're into hospitals and are putting themselves in danger for the future.
Yeah, Councillor Raskin, it's a really good point. I think absolutely right. We need to think about that. And we've, Councillor Grevsky yesterday just signed off his member decision on a new weight management service, really timely. And we've really carefully thought about that in line with the need for people to protect themselves from COVID in terms of weight. We've got a New Year kind of campaign and social marketing and social media. We do it very carefully and targeted for the new year to really encourage people to take steps to improve their health. And this does require a system-wide approach. It's not just about personal interactions, it's about how we support people and enable people to exercise more. And we've seen some of the good road schemes that are able to cycle. So there's a lot going on, and we are working through that and really trying to make those changes so that people can have healthy lives, protect themselves from illness, and at this time particularly COVID, and we're fully aware of that. So yeah, it's a really good point. And we're just finally, we've worked all through since the kind of first lockdown with clinical colleagues to enable them to understand which patients of theirs on their GP list would be more at risk from COVID, and invite them in and give them an intervention of behaviour change and making sure that their medications are up to date in order to protect them. So we've done that through the GP practice as well, all through the summer and continuing now for those more at risk.
Thank you.
Thanks, Simon. I think you make a good point, Ken. I hope that one of the things that will come out of this pandemic is that there will be a shift of resources more towards prevention and public health, because if nothing else, those individuals are, as you rightly say, people who have a weight issue, have obviously been more susceptible than others to this particular virus. So if we can get the health spending shifted across a bit, I think that would be one good result. And on a slightly lighter note, your comment about Christmas eating, I'm going this year, or we are going after quality rather than quantity. I think Judith was first, and then I got Judy Gillow after that.
Thank you, Keith. I'm sure your Christmas lunches are always quality. Simon, sorry. Simon mentioned my decision day yesterday, and yes, I was very happy to confirm the funding for the weight management service, which is not a mandated service. Perhaps we'll see it become a mandated service, and who knows, we might even get some extra funding for it. But in the sum that I approved yesterday, that included an extra £100,000 of non-recurrent funding for the first couple of years to help mitigate the impact of obesity on COVID-19 outcomes. Thank you.
Thank you, Judith. Judy Gillow, welcome.
Yes, thank you. And just really a question for Simon. In the comms, do you feel we need to be much clearer about social distancing and wearing masks? Because I'm just going back to Judith's point about the photograph in the supermarket. And I think there's many people that feel that if I wear a mask, I don't need to do anything else. That's protecting me. And I didn't know whether there was an emphasis on the comms just to make that point clearer.
Thank you, Judy. You're right. We work really carefully with our comms colleagues, and also taking insight work. And it's been a really kind of complicated journey with the comms, with the kind of messages not changing but nuancing during the time of this pandemic. And you're right. I think people are kind of mixing messages and almost taking the choice they want to. It's okay, I can wear a mask, therefore I can do X. Yes. And we are working through that with colleagues. Obviously, we've done a huge amount of comms. I think the most comms I've ever seen on a public health thing in the last 24 hours to get that out. And over the next week there'll be more coming out, but we will make sure we really pick up that question of social distancing. And if not, because I think it's, if you can't maintain 2 meters, wear a mask, rather than actually you can wear a mask, therefore you can exactly sit next to your neighbour, as it were.
No, thank you.
We'll pick that up. That's helpful.
Thank you very much.
Thank you, Judy. Any other questions at all? Are you happy then with the recommendation on page 9? And if you're not, put your hand up. If so, if you're not. If you are, you don't have to do anything. Okay, let's move on to item 7, and you're back in the chair, Simon, to tell us about your verbal update.
Yes, very quickly, because I think people are fully aware. So what we've been doing in the last few weeks and the kind of recent time is really preparing for the end of lockdown, and we've done a lot of work in preparation for that, and we publicly announced yesterday. So myself with the comms team have really made sure that message is communicated out really clear to the population. So that's really, really good, and it's gone very well. 2 other areas I'd just like to highlight to the board. One is around testing and how we really are making sure we've got the right testing capacity for our population, still a really important intervention. Working on 2 new initiatives. One is around the lateral flow tests, which are these more rapid tests, but slightly less accurate. So accurate, what I mean is they don't always, if you're test positive, you need to have a confirmatory PCR test. So we're making sure we use those in the right way to support outbreaks and other things. And I know that colleagues will have seen those used in different parts of the country, and we're working to make sure if we need to roll those out in our communities, we can do that. The second one is the local pilot of the salivary test from the University of Southampton. And again, we're looking at how we roll that out in the new year for various settings, including education and possibly some care settings not covered by the national programmes and other sites. It's worth saying that it feels like every week a new testing opportunity comes on board, which is great from a national announcement point of view, does take some logistics locally to run it. So even though the care home testing for visitors, Graham Allen and team are leading that, and there's other programmes coming on board all the time, they do take some coordination. And that also includes the building of new local testing sites for our area. They were paused for a little bit whilst the army were taken up by Liverpool. Now we're back on track building those new sites, particularly in the west of our county where there was less testing availability. So we're doing all of that. Finally, it would be remiss of me not to talk about the vaccination. Although this is an NHS-led programme, we are very heavily working with them, providing that public health leadership and logistics leadership to ensure this programme works really well for the population of Hampshire and the wider LRF population, local resilience forum population. And this will involve setting up testing centres and also local testing sites, vaccination centres, apologies, and local vaccination sites within each primary care network. The logistics of the Courageous vaccine, which is the Pfizer one, having to be stored at -70 for a considerable amount of time and only lasts out of that temperature a few days, means that's more likely to be used in the NHS setting and the mass vaccination centres. We are supporting that to make sure that the whole population can get access to a vaccination. And yes, I'm really pleased that the target is 75%, but let's see if we can beat that in Hampshire by really thinking about those populations that may not normally uptake a vaccine or a programme, and we're using all our connections and our communications through the services we have to promote that. So you'll see more of that in the new year as that rolls out. Complicated programmes, but really pleased that we have that vaccine insight, which will enable us to really move forward and be freer from COVID than we currently are. Councillor Manns, that's a short verbal update. Happy to take any questions on that or other programmes.
Thank you, Simon. There's one thing I would like to ask you, and that is that now that we've got a bit more control over track and trace and indeed testing, just can you say a little more about how we can target those areas that are on the high end in terms of positive tests, and the other criteria that determine which tier we're in? Like, I know we spoke this morning about the work we're doing in Havant, for instance, because clearly if we can, now that we've got more control over our resources, we ought to be able to actually focus them more where they're needed most.
Yeah, you're absolutely right, Councillor Manns, and I think as the data shows, Havant has been an area that's been higher than other parts of the county. So we're looking at that, looking at the data to really understand what might be causing that, and or is it just a collection of circumstances that are not we're able to understand. But we know that through travel and things like that, that there perhaps is more travel in that area to Portsmouth, the neighbouring area, because we know people work and commute that way. So we've been looking at that. And you're right, we now have more control over testing, so we can actually, if need be, focus some more testing there to ensure that people get tested. And as we pick up the local contact tracing, which we'll be picking up from the national programme, we'll then be able to phone from a local number, which does give people more, seems to give them more confidence in the service to say, I'm phoning from Hampshire County Council. They tend to then listen to the advice more clearly, and we can connect with various colleagues in the district councils and others to make sure that the advice is followed and people are supported should they need help with medicines or caring responsibilities. So we're looking forward to really taking that programme on board. It's a large-scale programme that will be starting as lockdown ends and taking that forward to enable us to really support the population to isolate when they need to and understand the advice they're being given.
Thank you, Simon. That's good. Ken.
Thank you, Simon. We are a large rural community in Hampshire, and many people who live in those rural communities have focused on their locality. So local shops, local situations, local entertainment by walking and cycling around their local communities. And that brings me on to vaccinations. So of course, it's great that we will have towns like Basingstoke and Winchester and Southampton all getting large vaccination sites, but the need for a localised, and I mean localised, distribution of vaccination is important to my population here in Basingstoke, and I'm sure through the New Forest and other areas that are rural will want to know that you, as Director of Public Health, will be pressing for localised vaccinations rather than have people travel 10 or 15 miles into big centres, that they can have an application of that vaccination in their locality, whether that be a village hall or somewhere where people feel safe, because they certainly don't feel safe coming into big urban environments at the current time. And obviously, the purpose of a vaccination is to get the most people vaccinated as soon as possible. So I leave that with you, and maybe some comment would be useful.
Councillor Rackham, you're absolutely right. You're right to say, from my perspective, I've been overseeing vaccination programmes for many, many years, including the childhood vaccination programme, the flu vaccination programme. And we know some of the things we need to do to ensure that the whole population can get vaccinated, as I said previously. So how do we work with those people who are perhaps less likely to get a vaccine? And from my particular, another area I lead on is drugs and alcohol services. So we know that population goes into, if they're accessing drug services, how do we make sure we get vaccinations through that service? So we're looking at all of that. I just need to assure you that each primary care network, which are based on the populations, and I think it's 37 across the whole of the LRF, will have its own vaccination location. So they won't have to go into Basingstoke. So the rural population of the New Forest will be going to the one connected to their area. Equally, a little bit like the flu vaccination programme, there'll be some delivered in the practices. It is quite logistically complicated because unlike a flu vaccination in normal times, you can all line up in the waiting room and kind of have an arm, roll your sleeve up and jab, jab, jab. People have got to be 2 meters distance, wait 15 minutes at the end. So we are using, as you say, village halls in each primary care network and other methods. There'll be a domiciliary service for those who can't get out. So there's a number of ways of doing that. The large vaccination centres, I think in the main, and this is still kind of being developed, we'll start off with NHS and care workers who may be more mobile and able to do that on their way to or home from work. So we're absolutely looking at making sure it's in all parts of the county so that everybody can access that. And we really will be looking at that data really carefully to make sure we don't miss population groups just because they're a little bit less likely to attend than population groups that are fit and able and kind of, engaged in health. So we're really looking at that, and I'll be keeping an eye on that during the next few months.
Thank you, Simon. Any more questions for Simon? Okay, well, thank you for that. And let's move on to item 8, communication engagement update. Judith, you're leading on this.
Yes, thank you. The visual format of the report is similar to the last 2 reports that you've seen, so I'm sure you've all got the hang of that by now. But could I just point out that this report relates to the 4 weeks up to the 12th of November, and because it's less than a month since our last meeting, it actually includes the last week of the last report, if that makes sense. On the left, you'll see the campaign summary, 164 social media posts, up from 97 in the previous 4 weeks. Not quite as many people reached, probably because much of the messaging was repeating previous messaging on the hands, face, space guidance, although new formats were used with more animations. Support for high-risk settings has continued, particularly to schools and the adult social care sector. And I was pleased to read some positive comments on the Facebook posts on the County Council's page. One lady had written, "Thank you. It's good to know we're not alone." And I thought that was really nice, because we see a lot of people like to get things off their chest and say things that perhaps are less nice. So it's always good to read something positive. Also, the schools cases data page has had 5,300 views, and the COVID-19 weekly summary almost 800 downloads. So that's we're sort of keeping our presence there, and people are seeing what we put out. Moving to the middle of the page, the team handled 70 media enquiries, resulting in 153 news items, higher than the preceding 4 weeks, and views of dedicated web pages, which I talked about at the last meeting, was up on the previous month. Specific support for high-risk settings, schools and the adult social care sector, as I've just said, has continued, and importantly, engagement with stakeholders at all levels of local government has carried on, and engagement with our members of parliament. On the right of the page is a summary of the activity relating to the national restrictions at the start of the 5th of November's second lockdown. And as I said at the last meeting, the comms were all ready to go on that. So, we just pushed the button and rolled that out as soon as we got the announcement. So coming up to date and looking forward, which I guess is what we all really want to do, the comms team were fully prepared for this week's announcement that Hampshire will move to the Tier 2 high alert level. We've prepared for all scenarios. So again, we're ready to roll with a clear plan of stakeholder engagement, media releases, social media content, updated website pages, newsletters, and so on. Specific and targeted messaging has covered a wide range of stakeholders, including the care settings, schools, businesses, faith communities, the BAME communities, prisons and transport providers, and those shielding, just to name a few of the sort of subsets that we are targeting. Now the future's fairly fluid because but we continue to be ready with the comms for every eventuality. These include explicit and careful comms for the 5-day relaxation on indoor gatherings over Christmas, whether we'll move down a tier on the 16th of December, and how the vaccination programme will be delivered when it starts. And of course, the expansion of testing, new testing technologies, and rapid testing, and all comms are going to be clear what the rules and guidance are now, what the position is now, not what's around the corner, and details of where we are, where we go from here, and what we can expect to have to communicate, you might be interested to know, can be found in the government's COVID-19 winter plan published a few days ago. At 64 pages with wide margins and a friendly typeface, it's a fairly easy read. There's a lot of information in there, so it'll be important to get key messages to the right people at the right time. I know people are becoming understandably weary of COVID, so it is important that we keep the message fresh, make it appropriate as we all pull together, hopefully, towards the light at the end of the tunnel. Thank you.
Thank you very much, Judith. I think communication is vitally important. It brought home to me earlier this week when someone said, I won't say who it was, what's been the point of the lockdown? We've ended up going into a higher tier than the one we came out of. And that's the sort of question that one has to explain, that we went into lockdown when the rates were going up. They're now beginning to plateau and possibly come down. And therefore, it's not surprising that we're in the higher tier. And of course, the other answer is that we only have 3 weeks of the 4 weeks in the higher tier available at the moment. So hopefully the trend that we've seen will go down further. And I think the other point that I'm struck by is the fact that I've seen at least once or twice on the media about the idea that once you've had the vaccination, you're immune. And and what we know, Simon and I have discussed this, it's important to get the message across that you've got to have 2 of them, spaced apart by a few weeks, and even after that there'll be a period where you won't be totally immune. And that's the sort of messaging that we will need to ensure goes out. And I think the final point I make is it needs to be clear, and we need to ensure that the messaging that we're giving is very much part and parcel what the NHS are giving, and any other body that's got something today, to try to screen out some at least of the sort of false messaging that finds its way onto particularly social media. Anyway, apart from that, that sounds fine. Other questions for Judith or Simon? Patricia.
Thank you very much, Keith. Can I thank Judith very much indeed for her presentation, because I thought it was very, very comprehensive and set out very clearly the extensive range of the things that we are doing to inform members of the public and all strands of members of the public, which really leads me to link back to the question put earlier at this meeting by Councillor Porter. Now, Councillor Porter will have seen from Judith's presentation this afternoon an outline of what the communications that we've had with schools, and I just wanted to reassure her that we've had extensive communication with the schools and the head teachers in particular, in enabling them and to working with them so that they get the right kind of messages out to the parents, to the carers, and indeed to the local community. Now, that's particularly true of all our maintained schools, and there are over 500 of those. So you can tell just how busy the comms team and the schools team have been. But having said that, I have a feeling that Councillor Porter was maybe referring to the academies, I don't know, or to other schools, and she's nodding, so yes, I think I'm right. Well, to answer your question, Councillor Porter, we have made it known to academies that we are here to help. But the decision has to be made by them. If and when they approach us, then we will do the same kind of support or very similar support, depending on what they request, to help them inform their parents and their immediate community. But of course, being academies, that is something that we cannot impose upon them. So we have had some interest from some academies, but we're very happy to take on more if they make inquiries with us. But in terms of our own schools and some academies, we've had a very, very comprehensive comms operation.
Thank you, Patricia. That's very useful. Are there any other questions? Right, okay, well, I think we've just about come to the end of the agenda. We're due to meet again on the 15th of December, which has turned out to be quite a useful day to meet, because it's the day before we go into the next period of lockdown. There is one point, Simon, or tier, I should say, the stay in the same tier or go to another one. Is that the date that we would actually change, or is that the date that they make the decision that we change? I wasn't clear about this.
My understanding is it's 2 weeks review, so it will be the date we change. It's my understanding.
Right, so we'll know about that a few days beforehand, in all probability.
One would hope so.
Yeah, right. Yeah, so we should know. What I'm really getting at, when we have the next meeting, we'll know which tier we're in, or who's in which tier, I should say, is probably closer to the truth. Okay, well, thank you all very much. We meet again on the 15th. Thank you for your help, your questions, and we just get on and try to continue to fight the virus, reduce its spread, stay safe, and help each other.